You wake up in the middle of the night and your hand feels dead. You've got pins and needles in your fingers. Maybe it feels like your thumb, index finger, middle finger, and ring finger have all left the group chat. So what do? You shake your hand, you flick your wrist, and you hang your hand off the edge of the bed like you're trying to restart the Wi-Fi signal in your fingers. And slowly, it starts to ease and you manage to get back to sleep. But the next night, it's there again. And maybe it starts happening when you're driving, or typing, or gaming, or holding your phone, or doing your makeup. And suddenly, the weird night numbness is there pretty much all the time. That is the classic story of something we like to call carpal tunnel syndrome, one of the most common nerve compression issues in the body. And in today's Injury Clinic episode, we're going to be breaking down exactly what carpal tunnel syndrome is, why it happens, who's most likely to get it, how serious it can become, and what treatment usually looks like, and why you should just not ignore the weird numbness in your hands. Because this is not just a bit of weird wrist pain, this is a nerve being squeezed in a tunnel that does not have that room to spare. So let's get into it. So what actually is carpal tunnel syndrome? Well, carpal tunnel syndrome happens when the medium nerve gets compressed as it passes through a narrow space in your wrist. And yes, it is quite literally a tunnel, but not a big train tunnel, more like a tiny wrist tunnel with terrible property value and absolutely no spare room. Possibly like one of those cupboards you'd pay $500,000 for to rent in Fulham. Now, the floor and the sides of the tunnel are formed by small wrist bones called the carpal bones. The roof is a strong band of connective tissue called the transverse carpal ligaments, or flexor retinaculum. Now, inside that tunnel, you have the median nerves and the tendons that help bend your fingers and thumb. So that tunnel is already pretty busy. It's essentially rush hour in there most days of the week. If the tissues around the tendons become irritated or swollen, or if the space inside the tunnel becomes tighter, the median nerve can get squeezed. And nerves do not like being squeezed. When a nerve is irritated or compressed, it can create symptoms like tingling, numbness, burning, pain, weakness, and clumsiness. This is why carpal tunnel syndrome is not just a wrist problem. It's a nerve problem at the wrist that can affect how your hand feels and functions. What does the median nerve actually do? The median nerve is one of the main nerves of the arm and hand, and it starts from the nerve roots actually found in your neck and travels down the arm, through the forearm, and passes through the carpal tunnel at the wrist, which then supplies the parts of your hand. In carpal tunnel syndrome, the classic symptoms usually affect the thumb, index finger, and middle finger. Shockingly, the parts of the hand that are innervated or powered by the median nerve, and the thumb side half of the ring finger. So if somebody says, "My little finger is numb," that does not fit the classic median nerve pattern as neatly, because the little finger is usually supplied by the ulnar nerve. That does not mean they're making their pain up, it just means we might need to think about other possible causes also. The median nerve also helps control some of the small muscles around the base of the thumb. And these are really important for grip, pinching, opposition, and fine motor control. Basically, all the little hand movements you do without even thinking. Buttoning a shirt, holding a pen, pinching a key, holding your phone without dropping it directly on your face. I've done that before. Recently as well. So when carpal tunnel syndrome becomes more severe, it can go beyond tingling. People may start noticing weakness, clumsiness, dropping objects, or wasting around the base of your thumb. And that is when your nerve is no longer whispering. It's waving a very obvious red flag. So how does carpal tunnel syndrome happen? And this is really quite interesting. There's just too much pressure inside that small carpal tunnel in your wrist. The medium nerve gets compressed, And then your hands start sending all sorts of weird signals, such as pins and needles, numbness, burning, pain, weakness, and the clumsiness that we mentioned earlier. But even more interesting is the fact that carpal tunnel syndrome is not typically caused by just one thing. It's often a combination of all sorts of factors. Sometimes your wrist position increases the pressure in the tunnel. Sometimes someone might even naturally have a smaller carpal tunnel. And sometimes other wider health factors can make an individual much more vulnerable to carpal tunnel syndrome. But I just want to focus on the wrist position specifically. When your wrist is bent forwards or backwards for long periods, pressure inside the carpal tunnel can increase. That is why people often notice symptoms when they're sleeping, because many people sleep with their wrists bent. It's also why symptoms show up during activities such as gaming, driving, and holding your phone. The nerve is basically saying, can we please stop folding this tunnel around me? Now, one thing I would be careful in saying is that typing directly causes carpal tunnel, because this is very simplistic look on the condition, and it's not entirely true. Typing can cause aggravating symptoms in some people, especially those with poor positioning or the long durations. But carpal tunnel syndrome is usually more multifactorial than you just need a new keyboard. But think of it like traffic. One car is not normally the problem, but if you add a narrow road, rush hour, roadworks, bad weather, and somebody doing 23 miles per hour in a 40, Fiat 500 drivers, suddenly everything backs up. But carpal tunnel syndrome is like that. The tunnel is narrow, the contents are busy, something increases the pressure, and the median nerve gets trapped in this enclosing circle of chaos. So, how would somebody know if they might have carpal tunnel syndrome? Well, the classic symptoms are the ones we've gone over previously: numbness, tingling, pins and needles, burning, and pain, typically in the thumb, index finger, middle finger, and the thumb side of your ring finger. And symptoms often start gradually, as with anything. At first, they may come and go. They might wake you up at night. They might show up when driving or when holding your phone. And a really common sign is people just shaking their hand out all the time, trying to make it go away. Movement can temporarily ease symptoms for some people, and it progresses. Symptoms may last longer, happen more often, or start affecting your hand function. And that's when people might start to notice dropping things, their grip feeling weak, their hand having an overall sense of clumsiness to it, and in more severe cases, the muscles at the base of your thumb can become visually smaller. And that's not something to ignore, because nerve compression is one of those things where early symptoms may be reversible, but long-standing nerve compression can be much harder to fully recover from. So what makes you more likely to get it? People who do a lot of repetitive wrist movements or forceful hand activity. The NHS lists several risk factors for carpal tunnel syndrome, and those include being overweight, being pregnant, repeated wrist bending or hard gripping, arthritis, family history, and previous wrist injury. Pregnancy can be a big one because fluid changes in the body can increase swelling, which can subsequently reduce space around the median nerve. Diabetes and thyroid issues can also make nerves much more vulnerable. More about that in a future video to come, I'm sure. Arthritis or previous wrist injury can change the shape or mechanics of the tunnel. And like I said earlier, some people might just have an anatomically smaller carpal tunnel to begin with. Evolution definitely sucks in this occasion. So the big message is this: it's not just the fact that your hobby or job have caused this wrist issue. It may be that your hand was already close to the limit and something small's just pushed it over the edge. Think of the median nerve like someone trying to sleep in the middle seat on a budget airline. It already doesn't have a lot of room. Then the person next to it starts to lean in. Then someone reclines the seat in front. Then your armrest disappears. Eventually, the nerve has to kick off about something. Now, what might the severity look like for carpal tunnel syndrome? Well, a mild case might involve intermittent tingling or numbness in your hand, but it eases when you change your position or you shake out your hand. A moderate case, on the other hand, that was good, might be more persistent. Symptoms happen much more often. They may last longer and start to affect daily tasks. And a severe case is when we become increasingly clinically concerned. This might involve constant numbness, clear weakness, loss of fine motor control, or wasting around the base of that thumb. And this is the part we really need to take care when we're understanding, because carpal tunnel syndrome is not graded like muscle tear. It's more about how irritated the nerve is and how well it can function. How often are these symptoms happening? How intense are they? Are they only sensory, or is your motor function being affected? Because once weakness and muscle wasting appear, that can suggest a more advanced nerve involvement. And this is when you really don't want to hear someone say, I'm just gonna wait until it goes away. Because your nerve can be patient, but it doesn't have the patience of a saint, so to speak. So how long does carpal tunnel syndrome take to fully recover? The honest answer is it depends on the severity, cause, and how long the issue has been going on for. For milder cases, symptoms may improve with conservative management. That might include a night splint, activity modification, hand exercises, and sometimes a steroid injection. The NICE guidelines describe a 6-week trial of conservative treatment, such as a neutral night splint, corticosteroid injections, and or hand exercises depending on the individual presentation. Just to add a side note in, steroid injections are only going to be used in the more severe cases of the mild issues, if that makes sense. We don't just want to be injecting everybody with a bit of wrist pain with steroids. They should only be used as a last resort. Now, on this topic, the NHS also say that if a wrist splint does not help, those steroid injections may be recommended, but symptoms can return after a few months. If symptoms worsen or other treatments have not worked, sometimes surgery can be on the table and you can have that discussion. Now, the surgery is called a carpal tunnel release. The idea is to cut the ligament forming the roof of the tunnel so there is more room and less pressure on the median nerve. The NHS says the operation usually takes around 20 minutes and may take about a month to return to normal activities, although individual recovery can vary in these situations. But here's the important part. If symptoms have been there for a long time or there is severe numbness, weakness, or muscle wasting, recovery can be slower and sometimes incomplete. The AAOS note that surgical recovery can be gradual, and complete recovery may take up to a year in some cases, especially when there has been long-standing severe sensory loss. The key message from this section is don't panic if you have pins and needles in your hands. Start to panic when you have hand weakness and progressive numbness, because with your nerves, time matters. What should rehab and management look like? First, we want to reduce the pressure that's pounding on that median nerve. A common early strategy is the neutral night splint that we spoke about previously, because the aim is to stop the wrist from folding whilst you're sleeping. This in turn reduces the pressure that's being placed on that median nerve inside the carpal tunnel. Remember when we spoke about the different wrist positions and how they impact the condition? Second, it's time to look at more aggravating activities. This doesn't mean you need to quit your job or stop typing forever, by the way. It just means to modify the dose. Can you take more breaks? Can you change your wrist position? Can you split the tasks you'd be using your wrists for across the day over a longer time frame? The aim is not to baby your hand forever. The aim is to stop repetitively annoying the nerve whilst it's trying to calm itself down. Third, exercises may actually help some people. This can include nerve gliding and tendon gliding exercises. The idea is to encourage movement in the nerve and those tendons of the wrist through the tunnel without provoking the symptoms. But these do need to be dosed sensibly and sensitively as well. If the nerve symptoms ramp up aggressively, you probably have overcooked it. The median nerve is not like your hamstring. You can't just keep stretching it until an issue goes away. You need to democratically persuade it. And fourth, strength and function matter later on. If someone has had symptoms for a while, they may have avoided gripping, loading, or fine motor tasks for quite some time. So later rehab may involve restoring your grip tolerance, wrist movement, thumb control, and confidence with daily activities. And finally, if symptoms are not improving, or there is weakness, constant numbness, muscle wasting, or major functional loss, that is when a referral, nerve testing, injection, or surgery might be considered. So the rehab message is super simple. Calm the nerve, create space, stop repeatedly provoking it, restore the movement, rebuild your hand function, and escalate it when the nerve is showing signs that it might need a little bit more help. I've been Max Darcy at the Injury Clinic. Thank you very much for watching, and I will see you again in next week's episode. Yes, I have a pint of iced coffee. It's Monday. I'm filming this video late, and if you couldn't tell, I'm half asleep. One of my friends keeps cutting parts of my video and using it as memes in the group chat, so Kieran, if you're seeing this, here's another one for you.